بسم الله الرحمن الرحيم. مساء الخير على حضراتكم جميعا. وانا عايز اشكر البورد على الاكسلنت اورجانيزيشن والانتر اكشن. الفكره جديده وفكره اوتستاندينج بصراحه. هخش دايركت ان شاء الله على الكيس بتاعتنا. He is a 52 years old male patient. He is a smoker, smoking about 1 pack per day for the past 30 years. He is hypertensive since 11 years. His father is known to be diabetic and his mother is hypertensive. And both his father and mother has a previous history of an ischemic heart disease, and his father has a history of PCI when he was at the age of 50. He is now presenting with palpitations and dyspnea on exertion. Upon examination, his blood pressure was 170 over 105 on 2 different occasions. His height is about 178 centimeters. And his weight is 103 kilograms with a calculated body mass index of 32.3 kilograms per meter square. His cardiac examination showed a regular rhythm with a heart rate of 72 beats per minute, and the ECG showed a voltage criteria for LVH with a strain pattern, and his chest X-ray was unremarkable. Echocardiography was done, and it showed an LVH with interventricular septal diastolic dimensions of about 14 millimeters, with a preserved ejection fraction and mild mitral regurgitation. His laboratory investigations showed hemoglobin A1C of 6.4%, fasting blood glucose level of 113 milligrams per deciliter, total cholesterol was 245, LDL 158, HDL was 34 milligrams per deciliter, and the triglycerides were 198. His creatinine was 1.2 milligrams per deciliter, with urine albumin creatinine ratio of 50 with an estimated GFR of about 62. He was taking amlodipine 10 milligrams once daily and atorvastatin 10 milligrams once daily. So to sum up, he is a 52 years old male, smoker, presenting with uncontrolled hypertension, with a previous family history of coronary artery disease. He is obese, with LVH, hemoglobin A1C 6.4%, the LDL was 158, having a microalbuminuria, taking amlodipine 10 milligram and atorvastatin 10 milligram. And now, according to the latest ESC hypertension guidelines, the risk stratification for this patient, if this patient considered low risk, intermediate risk, high risk, or very high risk.
اول حاجه الارض كنترول هايبرتنشن من الاثنين اللي يجي الفقار بتاعه 62 يعني شوف تحت الدكتور عايز يظبط الكلمه ولا لا. ثالث نقطه انك لو حطيته على سكور سيستم هتلاقي سن 52 سنه سموكر وبوليس وهايبرتنشن والتوتال كوليسترول بتاعه هو ليه الديسفانكشن مفيش قالوا ايه بقى؟ انترميديت 47% وهاي 52%.
Okay, the next question, please. Hemoglobin A1C 6.4. Is this patient considered pre-diabetic or diabetic or controlled diabetic? Vote, please.
هو الحقيقه بالنسبه لي كمان الامتحان بالاي1 سي ده ما اعرفش ليه كده ببقى يعني بيجي لي اشعاريه لما بشوفه يعني بحب اشوف فاصل من البوست زي
Fasting blood sugar for this patient is 113 milligram per deciliter. Next question. What is the target LDL for this patient?
Target LDL for this patient. أقل من 100 أقل من 70 أقل من 55 أقل من 130. فوتي سريع يا جماعة لو سمحتوا.
Okay, next question. What intervention should be added to reduce the risk in this patient? Either to increase the dose of atorvastatin, or to shift from atorvastatin to rosuvastatin, or to add ezetimibe, or lifestyle modification without increasing the dose of atorvastatin. He is maintained on atorvastatin 10 milligram. Okay, next question. What is the target blood pressure for this patient? Systolic less than 130, diastolic less than 80, systolic less than 120, diastolic less than 70. If he is more than 65, shall we be reluctant in the systolic and the diastolic, or all are correct, or A and C? Next. Which antihypertensive can be added to this patient to control his blood pressure? RAS blockers, or thiazides, or to shift to another calcium channel blocker, or beta blockers? Perfect. Next. Shall we start antidiabetics? Yes or no? For this patient with hemoglobin A1C of 6.4 and fasting of 113, shall we start antidiabetics? If you are going to give an antidiabetic to this patient, which antidiabetic are you going to choose? Sulfonylurea or metformin or SGLT2 inhibitor? Which antidiabetic to choose if you are going to give to this patient an antidiabetic drug?
معلش مش عارفين تعريف دلوقتي بليز لو سمحتوا باذن الله. انا كوتش لا معلش دلوقتي السيناريو اللي احنا بنعمله حضرتك دلوقتي كيس questions and then the cardiologist, the hematologist, and then the coach will ask the panelist. The questions will be three questions by audience. Okay, this is the scenario of each case. كلنا هنتكلم بس احنا المهم ان احنا نوصل في الاخر انتراكشن معاكم وفي الاخر الاساتذه بيكونوا معانا الكيس ايه احسن حاجه عملتها.